Search and rescue operations continue in the Philippines after Monday's deadly earthquake. The critical 72-hour window, widely regarded as the most important period for finding survivors, has now closed. At least 31 people remain missing. The 7.8 magnitude earthquake off the coast of Mindanao killed 47 people and injured more than 480 others. Recovery efforts have been hampered by more than 2,000 aftershocks, some measuring as high as magnitude 6.4. Monday's quake was one of the most powerful to hit the Philippines in half a century. It coincided with the first day of the school year for millions of students across Mindanao. The country's education department said more than 1,000 public schools have been affected. Reports say classes at least 4,000 schools remain suspended. President Ferdinand Marcos says the disaster could have been a traumatizing impact on children. He said teachers will be given specialized training on how to help students cope with the trauma. Mr. Marcos visited the hardest-hit General Santos City yesterday, where he pledged to fast-track aid and repair. He also announced compensation of around $800 for families who lost loved ones. Officials say the quake damaged more than 3,100 homes and displaced at least 45,000 people. Many are staying in government-run shelters, with some too traumatized to return home.
Ito po kami kasi yung mga bahay namin, lahat nag-giba. Tapos kailangan dito kami pansamantala munang magpahinga. Kasi pang doon sa mga gym, delikado din doon sa gym. Kasi pang doon na naman, isang buwan pa daw yung P-box. Sabi ng P-box, may aftershock pa daw isang buwan. Kaya dito muna kami para safe na kami dito kung ano mang mangyari.
The quake also damaged roads, bridges, and other critical infrastructure. Officials estimate repair costs could exceed $9 million. For a closer look at relief efforts in the Philippines, let's speak to Drew Strobel, operations manager at the International Federation of Red Cross and Red Crescent Societies. He joins me live from Mandaluyong City. Drew, thank you so much for making the time to speak with us. It's been days since the quake struck. Help us understand where relief operations stand right now.
Yeah, right. Thank you. This is a complex, large-scale emergency that's still ongoing. We're focusing on life-saving support through our partners, the Philippine Red Cross, but it's going to take a sustained relief effort to really help people recover.
That crucial 72-hour window to find more survivors has passed. What does this mean for emergency responders? Will search efforts still continue?
Yeah, they're fully underway and will continue. The challenges, I think you mentioned about the aftershocks, there's been over 2,000 aftershocks, so it's a really dangerous situation. So we need to take care of the caregivers as well. So they need to be careful as they're going in to extricate people from buildings that have collapsed, and the safety component is something that really concerns us. There's a lot of challenges on that front.
Could you maybe elaborate on those challenges? What steps do emergency workers and aid relief what kind of precautions do they have to take in this kind of a disastrous situation?
I think the challenge we're seeing right now is there's a lot of focus on the urban areas, but there's still a lot of rural areas that have yet to be assessed, and those are blocked by broken roads, bridges that have been damaged. So getting access to some of those remote communities is really a challenge for us, especially as you mentioned, the time is passing. So we're really focusing on getting to those outlying areas to provide life-saving assistance and help them on their way to recovery.
You mentioned the damaged roads. Are there still areas that haven't been reached by rescue teams?
Yes, they've done an aerial assessment, but there's still areas that are blocked with bridges being out and roads that are impassable. So yeah, there's still areas we're focusing on the harder hit areas. Philippine Red Cross always focuses on the most hard to reach areas. So until we get to those, our work will not be done.
So, in this kind of a situation, how long does it take then to reach all those affected in such a disaster, especially looking at the level of devastation that we've seen so far?
It'll depend on the context of each place, but yeah, I can tell you there's 110% effort by all the partners and especially the Philippine Red Cross to get to those areas. That's our main priority right now. We have emergency response units and damage assessment and damage and needs assessment teams that are in the field currently trying to reach those areas.
What are the immediate needs of not only relief workers, but also of those affected residents? What kind of supplies are in need?
Yeah, right. So water is usually similar with food assistance, water and sanitation and health, getting back to the basics. We have Philippines Red Cross has set up lots of medical tents in the hospital facilities that were damaged. You mentioned some of the infrastructure challenges. So setting up medical tents that can receive people outside the hospitals. And your report mentioned the psychosocial effect. I don't think that can be underestimated. Being the first day of school, we had a lot of children that were affected before they entered school, and so this is going to be a long term. There are going to be long term effects, and we're going to have a sustained effort to work with some of those communities and families and children that are traumatized by this event.
Speaking of the trauma that many of these residents and the students have faced, how does one process such devastation and loss from a disaster like this? And what kind of support is the IFRC and the government providing to those residents?
Well, we always focus on our partners, the Philippines Red Cross, so they're always there in the communities and they were present before, during, and after this event, and will continue to be there. So, really being a voice for the community and a source for and talking through these traumas, and we have efforts in psychological first aid, but also more sustained efforts in mental health and psychosocial services, which people can receive. But being there and present with these communities to hear their concerns and also help them with some techniques to help with the long-term recovery. The other concerns that come up as well, a lot of families are affected in terms of the livelihoods. So we have current teams in the field assessing livelihoods needs so we can help people get back on the road to early recovery and to full recovery in terms of financial assistance, and so they don't have to worry about their economic livelihoods.
That's right. Many of them have lost their homes completely, probably lost all their belongings. From your experience, Drew, how long could it take for residents to see some sort of return to normalcy in their lives? And what are the steps that it will take to get there?
Right. So currently we have a lot of people, 41,000 people in evacuation centers. So those displaced people getting back into some sense of normalcy with kids in school and their shelter needs taken care of. That could take some time. You know, I also reflect, I was here during Typhoon Haiyan, and so I know how resilient the Philippines people are. So they're really amazing in that aspect. But I don't want to put a timeline on it, but it could take some time as well. You know, this is a complex and fast-moving emergency. It's going to take some time for the full recovery to begin, but I can see some hopeful signs that it's already happening.
You mentioned that the Philippines is no stranger to disasters like the typhoon last year. How are medical facilities in Mindanao managing this tragedy? Were they prepared? And what kind of support do they need at this time?
In terms of the services they're providing now, I know there's alternative services. A lot of people don't want to go into the buildings, so we have medical tents set out in front, and Philippine Red Cross is helping with pre-hospital care, first aid, medical evacuations through their ambulance services. So, you know, I don't think anybody can adequately prepare for this fully, but there have been significant number of hospitals damaged that need assistance. So being able to provide that alternate care outside, you know, disruptions to power, disruption, the road infrastructure that you can't carry out evacuations. There's a lot of efforts that need to take place to find alternative ways to transport patients to the larger hospitals that are still functioning. So there's a wide effort that still is being undertaken at this moment to make sure those medical facilities get back to normalcy, right?
Thank you, Drew, for helping us get a better understanding of the situation on the ground. We were speaking to Drew Strobel, Operations Manager at the International Federation of Red Cross and Red Crescent Societies.